still about Islam in comparison to someone that is a new Muslim, a revert. The discussion will be different. The goals are the same, the discussion is different. And this is what the point of why the media and these memes and this false information that's being sent out there needs to be identified, and it needs to be given at least an analysis, and the experts need to give you an opinion. And I can tell you now, 99.9% of doctors, health professionals, these are doctors, experts in their field, agree with what Dr. Mohideen is going to say: go get vaccinated. So with that in mind, my first slide is just to confirm vaccination is not new. It is saving millions of lives. They estimate we save 2 to 3 million lives a year from vaccination. You can see the big difference of what happens in these slides with diphtheria, whooping cough, measles, and as soon as you see the vaccination occur, you can see the dwindling of the disease process. And you can see from the various introductions of these vaccines, it changes. And from my slide next to it, you can see even the development of the vaccines. Back in 1980, there were thousands of antigens, things to actually stimulate the immune system. But in fact, by 2017, you didn't need as many to get the same result. Again, this idea of how good vaccinations are, and unfortunately highlighting not every disease is capable of getting an actual vaccine. You can see malaria, tuberculosis, dengue fever is still going on. Zika fever in South America is still going on, where we don't have a vaccination, we don't have a cure. Now, I just wanted to show these slides, which are important, and the idea, you can see that the certain groups are really leading the way in terms of vaccinating their population. In fact, the vaccination in the United Arab Emirates, and then second is Israel. The number of people that they're vaccinating is huge. Australia, in comparison, is barely, I would say, almost coming closer to 2% of the population. So you can imagine it's so small. You see the vaccination, and I just wanted to get in the idea of the various vaccinations, the AstraZeneca, the Pfizer, and there are others. There are many around. The concept really that I wanted to focus on today is this idea of herd immunity, and why is it so important? Herd immunity, which is basically the whole purpose and the way vaccinations are effective. And if you have a look at this slide, you can see in blue, these are the vaccinated people, and here's one person that's infected. One person can slowly and very quickly infect a huge number of people very quickly. But in comparison, when you look at it to the large number of people vaccinated, it doesn't mean that they cannot infect a few people. It means that there is not a major issue and the disease is unable to spread fast and it doesn't get out of control. This is the whole idea of being vaccinated. The idea of being vaccinated, the final goal is to achieve herd immunity, where there are so many people vaccinated, even as you get some people that are infected, it is unable to rip through the actual population. I just wanted to confirm very quickly the Australian Fatwa Council gave an Islamic verdict about the vaccines. We know both from America, and these are from America, and the British, they've all agreed that the vaccine is halal. It doesn't contain animal products, doesn't change your DNA, and it is completely under the auspices of Islam. I didn't want to go through too much in terms of COVID-19 and exactly what COVID is, but effectively, if you really want a succinct idea, the problem with COVID-19 is that it is a respiratory virus and it affects your breathing. The whole idea is that once you become breathless, which is what the virus does, you cannot remain breathless for very long. It's too exhausting. And it's only once the disease goes from being asymptomatic, mild, and then severe, and it doesn't take very long for that to occur, that when you are breathless and you present to the hospital, the only next step that the hospital will be able to do, apart from giving some oxygen and all these other medications, is to take you and breathe for you on a machine. And that is where all the major issues can occur. From my perspective, I just wanted to quickly, and this picture is obviously from the Pacific Islands, where you can see these people have actually got a boat and actually rowed all their way to this poor individual who's giving a vaccine in who knows where on a grassy part of an island. I think we really have to be grateful of being in Australia with so much availability of the vaccines, because I think this is an essential part, because right now it's as if we're not grateful enough. And when the vaccines are offered, when the vaccines are free and the vaccines are safe, the idea of just following non-experts, the idea of just following the herd of people that are just anti-vaxxers, anti-everything, with no science whatsoever, with 99.9% of experts agreeing to get vaccinated. And so I wanted to just make that clear. I wanted to make sure that the Board of Imam members understood that concept, understood that the whole purpose of vaccination is to achieve herd immunity. It's not perfect. No one is perfect, but the idea, it is as good as it comes. Muchakirin, thank you very much. I hope that's just a quick overview of the idea, and I just hope to answer questions, and I do have slides to answer the questions, but I thought that might be the best way of doing it.
Thank you, Dr. Ashraf. It has been very nice presentation on the vaccines. And you have apparently said about this, will it alter DNA? And this is one of the big questions that people are asking about. And one of the main questions is also the skepticism in which that the anti-vaccine people are being propagating, that it can alter your nature, your DNA.
I can tell you that now. So the idea of DNA, the idea of changing a DNA, it's not even possible. It's an mRNA virus, so an RNA. It doesn't actually go into the nucleus, and it's the nucleus where your genome is found. The mRNA goes into the endoplasmic reticulum in a different part of the cell into the cytoplasm. That vaccine, the mRNA, does not enter the nucleus. That's not the mechanism, nor does it ever change your DNA.
Yeah.
The unfortunate idea is it is like someone reading a few hadith, a few ayah, and then deciding that they want to create a fatwa. That's literally what these anti-vaxxers are employing, and people are listening. What I can't comprehend is when experts in their field are giving an insight. What I can't understand is how people are actually following it, because the first thing these people say is, look, I'm not an expert, but I've read some stuff on the internet. That doesn't work even to be an alim. It doesn't work even to be a sheikh. It doesn't work even to be an imam, let alone anywhere in the world, wherever. All of us are from diverse countries. You cannot go to a university, turn up and say, look, I've done some research on Google, I've read a lot, can you admit me and I'm going to teach the students as an expert? No matter which country, Pakistan, India, Sudan, Egypt, they'll laugh at you. They will literally say, you're not an expert. Why? Because there are nuances. We actually have to do courses to actually look at the research articles, because they are always biased. There are reasons why they do the articles. And I think that is so important. You can't just get 50 articles, take the conclusions, and then create an idea. It's really dangerous. And so I'm all for discussion. I'm all for debate. I'm all for people investigating themselves. But I'm also all for listening. For me, I want to listen to what the imams say. I do. I want to listen to what the sheikhs say. I do. because they have such a grasp on something that I'm not an expert in. That's why it's obligatory for me to actually turn up to Joma. That's the whole purpose, because between Joma and Joma, someone like me can get misguided and I'm all over the place. I need to come back to the Imam, and the Imam's supposed to tell me, okay, look, listen, I need to guide you because, this is my role. And by Friday, after the khutbah, I'm like, right, got it clear now. I think so I was all over the place. Now I'm set. And that's the idea. So I hope that helps.
Can I ask question? This
Yes,
is
yes, Sheikh Isa.
Okay, thank you. Thank you, Dr. Ashraf, for your succinct presentation. Always we love to hear brief talk and then have more open discussion. That's what always gives a good impact to the matter. My question is, why people are worried? Why they are not coming quickly to accept vaccination? I haven't asked. I finished it. I did not finish the question. It's long, a bit long. The vaccination, it's a medical matter. It's a science. It should be perfect, almost perfect, close to 99.9 should be like that. But now we hear, maybe it is politicized. We hear that UK citizens cannot travel. I heard this news today. They cannot travel to UAE, sorry, not UAE, to Sudan, to Egypt, to Bahrain, because there is a pandemic outbreak there. If all UK citizens have been vaccinated with the AstraZeneca, why the government doesn't allow them to travel alone?
Okay, I think I get what your question is. So I just want to make sure one thing. The idea of vaccines, I just wanted to go back, which is why I put my slide, the idea. The idea of a vaccine being 99%, that's not what happens. That's nowhere, like taking an aspirin, if I give you paracetamol, if I give you anti-inflammatories, it doesn't work 99% of the time. That's not the goal of the vaccines. The goal of the vaccines is to create herd immunity. That's the idea of vaccinations. So more of us, not all of us necessarily, even if the actual vaccine, the tablet or whatever I give you, doesn't matter how you get it, if I give it to you, not all of you create the necessary army to fight COVID-19, not everyone, even if we take the vaccine. But the more people do, the more we protect the vulnerable. Do you understand? So it has nothing to do with the percentages. It has nothing to do with the type of vaccine. What you're trying to do, there's 5 of us on my screen right now. One of us may be a bit sicker than the rest of us. If 4 of us are vaccinated, we are protecting the one that hasn't. Do you understand? It's not about the percentage of how good the vaccine is. It's not the brand. They're all the same. The technology is amazing. It's like you're debating between an Audi, a Mercedes, and a Ferrari. They're all the same. They're all the same. Does that answer? And the idea that they don't want you to go to the other countries is because of the fail-safe, because they are not able to get a herd immunity. You need a population, 60, 70, 80% herd immunity.
Okay, clear.
Just to add to a response to what Ashraf has given you, with the COVID vaccine, I think people also need to realize there is no 100% guarantee that you cannot get infected. You can get infected with the COVID even after you got vaccinated. But the positive part of it is, even if you do get COVID, you will not get a full-blown attack because your immune system is already in kickstart and it will be fighting the virus as well. So this is why they are strongly not recommending people should travel to countries where it's in pandemic as well, because there's no guarantee that, like for example, I got vaccinated. I travel to a place that has a high level of COVID. I can still get infected. I can still come back. I might not get a full-blown attack, but I can still spread it to other people. So this is, I think, very clear with this particular COVID vaccine. We cannot guarantee that you cannot get infected again. Yeah. That's the clear message that comes out from the vaccine.
Thank you, both doctors. There another question that is, coming from the community is that AstraZeneca is, can cause blood clotting. And I have talked to many imams, and they all said, I will wait for the Pfizer. What is your comment, Dr. Ashraf?
So there's a couple. I can put a slide up. I might please. I can put your slide up just so I'm pretty, because it does make it a bit easier. Just to and I'll just flick through, because it just might make it a bit easier. So this one. So if I just give you just an idea here. So if you have a look here, the idea of a clotting rate in Australia, this is the idea of the clotting in 2.1 million doses after the AstraZeneca. This tiny dot, this is in relation. These are all in relation, like mathematically. The number of clotting, 24. 1 in 88.001%. The number of deaths is 1. The risk is incredibly low. But here's the kicker. Here's the issue of whether it's Pfizer or whether it's not Pfizer. Clots, if you're so worried about clots and Pfizer and not Pfizer, the AstraZeneca, in fact, is, they reckon worldwide, 0.0004% risk. But if you get COVID, your likelihood of getting clots is 16%. So you're worried about Pfizer or AstraZeneca. If in the interim between you getting vaccinated, you get COVID, your risk goes from, you're comparing 0.0004% because you're worried about AstraZeneca versus Pfizer, and your risk if you get COVID, it's 16%. Doesn't make any sense. So by waiting and not being vaccinated, you're accepting 16% risk of a clot. Why? Because COVID, I'll just show you. COVID, this is so these are cerebrovenous thrombosis, so clots in the brain. This is what the idea of these venous thromboses cause. You can see that the Pfizer, Moderna, AstraZeneca, they all can increase slightly, very small. General population's not even 0. But COVID, if you get COVID, your risk of getting this is way higher. Does that make sense? This idea, again, this idea of trying, and just another, I'll just stop sharing my screen, but just another part that I also want to make sure is very clear. For AstraZeneca, they talk about clots, and in general, most clots occur in young females, right? For Pfizer, the data coming out of Israel is that it can cause myocarditis in males. So the Pfizer may have a higher risk of inflammatory changes on the heart. AstraZeneca, higher risk of clots in young females. It's still very small. Again, the whole point of vaccination is herd immunity. You're trying to get the entire population vaccinated with something so your risk is lower, so your community is lower. By delaying, as an imam, if you delay, you are telling everyone in your congregation, don't get it. And if you say that, the mosques will stay closed. The mosques will have an outbreak in your mosque. Then there will be no Jummah. Then there will be the fitna of our community being labeled as people that do not get vaccinated. That is not what we want. And this idea of hanging our hats on, I want Pfizer. No, I want, and then what I hear from doctors that people are actually being aggressive to the nurses and doctors when they're not given the correct response. I mean, that blows my mind again, someone can be, the lack of respect to the people giving the vaccines for free.
Doctor, another question from Sheikh Isa. Dr. Muhammad Muhyiddin and I were part of a workshop 2 weeks ago that Department of Health organized. There came a very, very important question that I think many people in our communities are struggling with it. The question was, people who were born in Africa, who lived in refugee camps, don't know when they were born, whether they are under 50, whether they are over 50, they don't know. And based on that, they don't know which of the two, AstraZeneca or Pfizer, to choose.
This is my point. But this is my point. It makes no difference.
The presenter,
can I answer that?
the presenter did not have the answer to that question.
Ashraf, can I answer this question? Jazakallah Sheikh Isa, this question has come up not only from in that workshop, in many other community engagements. There's a lot of refugees who might not know the real date of birth, and they might be falling in that category of between 45 and 55 and all that. As Ashraf mentioned very clearly, both vaccines are effective. The chances of getting clot from AstraZeneca is very low. So if you are really 45, but your documents say you're 52, you'll obviously be given AstraZeneca. That is not going to cause a big problem because, again, as Ashraf mentioned, like in Australia, over 2 million AstraZeneca doses have been given, and we have only had 24 cases of clotting, only 1 death in that. Everyone else has recovered, and today there's a very good system to identify people who possibly, after being given the vaccination, within the 5 days, if you develop any symptoms, you need to go to the doctors, and they can treat people who have got the clotting very fast. And there's no one at the moment in ICU due to clotting after the vaccine. So it simplifies the thing that it really does not matter whether there are lots of young people who have been given the AstraZeneca. Remember, before the clotting issue cropped up, about 25% of the people who have been vaccinated are all under 50, have all been given AstraZeneca. And there's not been hardly a case, except the cases that we have reported.
Can I just make one point very clear? The idea of differentiating between the vaccines between 40 to 50 is nothing to do with medicine. It has nothing to do with medicine. It has all over the world. It's not based on age. It's not like something occurs at 49 and then once you click over to 50, your physiology of your body changes. It has nothing to do with the medicine. This is just stratifying, trying to put people in boxes to give you one, to give you other. Yeah. It has, whether you are 42, 47, 53, makes no difference. It may affect numbers in terms of studies to try and figure out how effective the vaccine is, but it's not actually to do with the medicine. So whether someone's 30, 20, 40, that's irrelevant.
And remember in UK, they brought it 30 and below. When the clotting took place in UK, they brought it. What I'll do is maybe I'll take them through the slides of what I have to present, and then we can go back to the questions.
I think there's one question still. Oh, you're muted. You're muted, Board of Imam. You're muted.
Sheikh Nawaz.
We have one question, and then we will go to your presentation. Yes, whoever, I think FMHO, can you please ask your question?
Hey, that's me. It's Fahmi here.
Yeah.
Assalamu alaikum to everybody. Dr. Ashraf, I think I met you at the Premier's Breaking Fast function the other day. I was seated next to you.
Assalamu
alaikum. Just a simple question. I agree with all what you have said, both of you are saying with Rizvi. Don't you think this whole discussion has got out of control, I say in Australia, because of the failure by the government to at least offer two options? You see, if they had both the AstraZeneca and the Pfizer, that's the issue here, because of underlying health conditions, different doctors are giving different opinions and people also making different conclusions. Do you think if there had been an option like in Singapore, when people go there, they ask which of the vaccinations do you like? So people do their own research and they say, yes, I have come for the vaccination and I will take this vaccination. So finally, the outcome, like you say, would be the same if the 2 or 3 options had been there, and these discussions would not have gone to this extent so far.
Thank you, Dr. Fahmy. Yeah.
Look, to me, I get it. I mean, I'm sure that in an ideal world, people turn up and they say, look, I'd like vaccine number D because it fits who I am. I'm a doctor. I want the expensive one and I want the one labeled Ferrari. I get it. And 100%. If you want the fire, I get it. Easy, no problems. I get it. But the fundamental thing that I suppose, and again, it's Islam, one of the things that of to be shook, we forget how grateful we are, is that I only have to hark back to Egypt, where my dad's brother, he's upset because he's getting the Chinese vaccine. And I said, well, what's wrong with the Chinese vaccine? Good luck to you. And he says, there's no reaction. You get the Chinese vaccine and there's no, I don't get sick, I don't get a fever, I don't think there's anything in it. and so he goes around and looks for the other vaccines, because while here in Australia, if someone has a reaction, I got a fever, I feel sick, they're like, I hate these vaccines. In fact, in Egypt, they're trying to look for the ones that make you sick. So I know it sounds strange, but wallahi, we have to be grateful for what we have. Whatever we have, you go get it, and then we move on. And inshallah,
Fahmy, to just address that question as well, I think we have to face reality. We know the federal government failed in getting the getting Pfizer. We are with a supply of more AstraZeneca than Pfizer. At the moment, the Pfizer doses that are available, for example, in Victoria, is 70,000 doses of Pfizer per week and 40,000 doses of AstraZeneca. But we are also producing a lot more AstraZeneca in Victoria, given that we have CSL that does the production. So when you have a shortage and a supply issue, you have to identify the key area of people that need to be given which type of vaccine. Like, for example, under 50, there's a whole heap of people that are being given, like, for example, the aged care facilities, all our reserves, all the army, military, frontline workers, majority of them are being given the Pfizer vaccine. So again, it's the priority that has now mattered. It's not about a person going and saying, I want this or that. At the moment, we are keeping the Pfizer vaccine to vaccinate those vulnerable people and those who are dealing at frontline with the people who are infected as well. So that's the key issue. When there'll be a time will come, I'm sure, end of the year or maybe next year, where because remember, the federal government has ordered 40 million doses of Pfizer, 53 million doses of AstraZeneca, and there's another, we are also going to get Moderna into the system. So by end of this year, so by next year, people might have the option of getting whichever vaccine they want. But at this stage, and also to add to that issue, what we are facing now is there's a lot of people who are now ready for their second dose in Pfizer. Because remember, with Pfizer, it is given within 3 weeks. Whereas in the case of AstraZeneca, it's a 12-week gap between the 2 doses. So this is at the moment, the demand and supply is what's driving which vaccine people are going to get at the moment. But people with underlying conditions, if their doctors are giving them letters saying they might not be suitable for AstraZeneca, are being given Pfizer. For example, another case is if you were to get AstraZeneca and you developed very harsh reaction to the AstraZeneca, and your doctor might say it's better for you not to be given AstraZeneca, your second dose obviously will be Pfizer. So there is also the exceptions to the rule, but this is basically, we have to understand there's a supply and demand issue that's at the moment.
Okay, Dr. Mohiddin, can you please make your presentation, and then we go for the for the for question and answer.
Okay. Yeah. So, yeah, Jazakallah, and just to add, I'm the vice president of ICV, but I'm also wearing another hat. I'm also one of the managers in the Department of Health that is dealing with COVID vaccine program, and I'm specifically in charge of the Cal community and the Aboriginal community as well. So I just want to touch, I think Ashraf has touched in detail about the COVID vaccine and all. I'm going to take you through the key things, how this vaccine, there are three pillars that govern the vaccine rollout. One, it is accessible to all people in Victoria. Basically, it's accessible to every single person in Australia, whether it be a person who is here legally or a person without any documents. So it's easy to access, and they're also looking at all geographical locations. We are vaccinating people in also remote areas, whether it be Cal community, Caucasian community, even the Aboriginal community is being vaccinated. There's highest level of safety being looked at. Every day they look at all the feedback they get from various sources about how the vaccination has taken place. There's each night people sitting down to analyze the data, analyze the feedback and all that. So it's constantly, and this is why, if you remember when there was that problem with AstraZeneca, the ATAGI immediately stepped in and there were immediate decisions made of limiting the AstraZeneca to people over 50 and offering Pfizer to people under 50. And the third thing is having public trust and confidence. And sorry, just so having public trust and confidence in people, building the confidence. And this is an ongoing work, because we are now, for example, we are sitting with the Board of Imams today and talking about the vaccines. So this is building confidence and talking to people. And what I have found is the best message is when the message comes from the community to the community. It's not coming from the Department of Health. It's not coming from anyone. When we have got people who have built the confidence, whether it be imams, doctors, community leaders, they are the most effective way of spreading this message. So just to give you, this is how the rollout took place. Initially, you saw the 1AB, they were the frontline workers, and this is where majority of them were given the Pfizer dose at the moment, and AstraZeneca, most of them were given Pfizer. So this is where the Pfizer was used up and is now being used up as again. Then on 3rd of May, they decided to open up, when they decided that under 50 and over 50 scenario came into play. They, from 3rd of May, it was open. Anyone over 50 was offered AstraZeneca. And this is the time I reached out to Sheikh Nawaz to get some of the imams vaccinated as well at that time. So today, if you look at who's eligible, everyone under 50 is Pfizer, and over 50 is being given the AstraZeneca vaccine. And again, like from Friday, the Prime Minister announced all Aboriginal people over 16 are now being given the vaccination. Another group that was highlighted and they have started the vaccine is people on disability. The national NDIS people are also being vaccinated. And a final group that has been identified from last Thursday was the people living in high-rise buildings. Like, for example, the Flemington Towers, the North Melbourne Towers, the Carlton Towers, because given what happened last year, and if there's a small outbreak in one of them, it can easily spread. So those people, irrespective of the age, anyone over 16, they are not vaccinating anyone under 16 because the studies are still not out there to say that they need to be vaccinated. But some countries, I know, for example, UK is trialing with people over 12. So, but in Australia, the TAGI or TGA are very specific. Only people over 16 will be given the vaccination. Sorry. So I think I won't go into this slide because Ashraf has spoken about it. So just to give you, so again, they have prioritized various groups of people age 50 and people under 50 as well. Anyone under 50 who wants to get the AstraZeneca is able to get it. And if they want to get it, they will sign up a form of consent. There's a formal consent to say they're happy to get the AstraZeneca. So you can see, if you look at all the groups that are being vaccinated at the moment with Pfizer, people who are age 40 and over, 40 to 49, hotel quarantine workers and their families, healthcare workers, aged care staff. You saw there's a blitz in the aged care facilities where they were being vaccinated. Disability care workers, critical high-risk workers, so people in the meat industry, police industry, all those industries, and anyone with a medical condition over 16 would be given this vaccine. So this is why there is a big demand at the moment for the Pfizer, and these people are priority at the moment. So we are trying to get all of them vaccinated as fast as possible, because if they, God forbid, they get COVID, they would be having a greater impact on them than hopefully the general public. So some of the things to know about vaccination, and one of the key things, as a microbiologist, and Dr. Ashraf will also agree with me, that when you get a vaccination, sometimes it's good to have a reaction, because that tells you your body is fighting back. With a vaccine, what happens is your body starts producing antibodies. That's our soldiers who fight back on any infection. And we all know with viruses, we do not have antibiotics. We do not have any medicine that we can take. It is our immune system that has to kickstart and fight back. And the best immune system is the antibodies we produce. So sometimes when people are given these vaccines, and I'm now specifically talking about Pfizer and AstraZeneca, 83% of people after the second dose might feel pain. In the case of AstraZeneca, what we are finding is people after the first dose will show some of the effects, side effects, and some people have no effects. I was talking to Sheikh Isa, who said he got vaccinated and he didn't feel much, he didn't have much side effects. People will have tiredness, Pfizer 47, AstraZeneca 76. Headaches again, in the case of Pfizer after the second dose. In the case of AstraZeneca, most of the times it's after the first dose. People who have taken the second dose have not shown much side effects as well. Aches and pains, very common. Fever, again, 4 to 8%, very low states in these two vaccines. Now, anaphylaxis reaction is sometimes your body reacts towards various vaccines. And this is why when you go to get the vaccine, it is important for you to remain in either the surgery if you're going to a clinic, or if you're going to a mass vac site, to remain for 15 minutes. You are supposed to sit there and wait for 15 minutes. But if you are feeling a little bit uncomfortable, and you must wait at least for 30 minutes in that particular place so that they could observe you. And if there's any side effects, they can act and help you as well. So please, the message to everyone, when you do get the vaccine, please remain for that minimum of 15 minutes at the place where you get vaccinated. A message that, again, Sheikh Isa spoke about hesitancy, especially among young women. There is this myth out there saying that it can affect fertility. No, none of the vaccines can affect fertility. That doesn't affect the fertility of anyone, but the AstraZeneca or Pfizer vaccine is not being given to any woman who is pregnant. If you're pregnant, you will not be given the vaccine. And this will be asked from all women when they go to get vaccinated, whether they are pregnant, because there is not sufficient studies that have been done to say it is safe or it can be given at this stage. So maybe this will change as time goes by and we develop much better, stronger vaccines. But at this stage, any pregnant woman is not given the vaccine. She can have it after giving birth. If she is breastfeeding, she can take the vaccine, or she can take it before she gets pregnant, but not during pregnancy. Again, access, again, I've gone through this slide. There's over, now at the moment, there's over 40 centers that are open to be vaccinated. You have to ring up and book an appointment. Like you can see, not all places offer both vaccines. Only some places offer Pfizer, but all centers offer AstraZeneca. It is best at this stage, because there's such a big demand and every center is full, to make your bookings. You can still walk in and stand in the queue and get vaccinated if you want to, but it's suggested if you want Pfizer, please make a booking, because sometimes they might not have enough of doses for the day if people go beyond the numbers that have booked in. Because remember, with Pfizer, one of the key issues with Pfizer vaccine is the storage and transportation, because it has to be kept at -70 so that it doesn't lose its efficacy. So when they do thaw it, they must complete and use up all the doses that they have thawed and brought into the place of vaccination. So total doses at the moment given in Victoria, this is the official number that has been given in the hubs, which means the mass vaccination sites. So there's over 500,000 given in Victoria in total up to date. In the last 24 hours, or 24,000. But this does not take into account the number that has been given by GPs, because remember, the GPs started well before, and this gives you an idea of how many in GP clinics that have been given. So in GP clinics, there's over 584,000. So if you take Victoria as a whole, we have vaccinated over 1 million people. So this is why, if you see the total number of vaccination doses given is 4.9 million doses have already been given in the wider community in Australia. So again, worldwide, over 1 billion doses have been delivered. The safety is there. There is possible of some rare conditions, and we know in Australia we had one fatal case due to AstraZeneca. And remember, I just saw a few weeks ago that somebody had put up a picture of saying only one death due to COVID, 200 deaths due to the vaccines, some other misleading statements. Like, we know in Victoria alone, we have had over 800 deaths last year. So even that just first statement saying there's only been one death due to COVID is misleading and wrong. So again, I've used this analogy, like, you know how sometimes people who are against Islam take one line from the Quran and say, see, the Muslims hate non-Muslims. This is the same thing. They have taken the detailed document in the site, TGS site has a detailed document which says there have been 200 deaths worldwide, not just in Australia. And as Ashraf mentioned, it is due to all the different vaccines, not just AstraZeneca. So again, please, can I humbly beg everyone to please tell people to look and read the correct document and read the details of the documents as well. So again, just this is the vaccination that is available. You can ring this number 1-800-675-398 or make a booking. Again, a simple message to everyone, because this is a question that I've heard many times. Is it available for the refugees? Is it available for parents who are now visiting here, who are stuck here? They are from overseas, but not Australian citizens or residents. Is it available for everyone, international students? Every single person can be given this vaccination, and it's free. No one need to pay. If you don't have a Medicare card, you can go online and apply for an IHI. If you don't have that, you can still go to a vaccination site and get vaccinated. But if you don't have a Medicare card, you cannot go to your GP to get vaccinated. You have to go to a federal government high respiratory clinic, or you can go to any of the state government open vaccination sites. Where I've given you about 40 sites. You can go to any of them and get vaccinated. So please convey this message to everyone. No one will be denied this vaccination. It is vaccination for everyone and every single person on Australian soil. So these are some of the information. Jazakallah, and this is all I wanted to convey. Just another quick message I wanted to say. Again, getting vaccinated is not going to stop you from getting the infection. So vaccination is one tool. The other tool is wearing the mask, making sure you keep your distance. If you're not feeling well, getting tested, and making sure you wash your hands or use the sanitizers. So it's a whole heap of things together that will keep us, keep you, your families, and the community safe. Jazakallah.
Thank you very much, Dr. Mohideen. It was a wonderful presentation. We understood the vaccination, vaccines, the process, and the safety of it, the halalness of it. both Australian National Imams Council's Fatwa Council issued a halalness of these particular vaccines. And also we have understood how safe it is for the people, and the doctors are very loud on saying that it is really safe and please go and vaccinate. I hope this presentation will go a long way for the common people who are following this, and also who are probably watching after this, and then they will be convinced. And I just want to ask Sheikh Isa, you have had your first dose of the AstraZeneca. Can you please, what is your message to the people?
Well, I'm going to have a talk on SBS Radio Somali program next Wednesday. I will explain more there. I went to the clinic on the beginning of May last month, and I did not have any concern. I did not have any anxiety. I went there, and when I was given the injection, to me, it reminded me the vaccination that I had 50 years ago, 60 years ago, when I was getting infected for some diseases in Somalia. It was just a reminder of what I had long time ago. And as Dr. Mohiddin said, I stayed there for 15 minutes. Nothing happened to me. Came back to my house. Nothing happened. The 24 hours. It seemed to me that I took that day a tablet. Nothing more, nothing less. That is my experience. So the vaccination, as Dr. Ashraf and Dr. Mohiddin have clearly said, it is harm minimization, is to minimize the risk or the harm that one could get without the vaccination.
Yeah.
Thank you.
Okay, thank you very much. And for the listeners, if you think that you need to ask a question, you can raise your hand. There is a hand raising function, and we can ask the question. And we have Sheikh Saeed Varsama, one of our imams from Melbourne Grand Mosque. Do you have anything to say?
I think, mashallah, we have been very blessed with talented Muslim health professionals here in Melbourne. Mashallah, we have our Dr. Ashraf, Brother Muhyiddin as well, Dr. Muhyiddin. This is a great, opportunity for all of us. We haven't issued this in this day and age of, information being spread on social media. And it becomes, to the extent that people will trust everything that comes to them on the social media over the experts. And this is a problem not only in the health field, but as Dr. Ashraf said, we're also having this issue in Islamic matters. So alhamdulillah, it's beautiful to know that this opportunity is there to learn, to educate, and even the health opportunities that are afforded to us here in Australia are amazing. I mean, many people would have already seen people fundraising for people to go to hospitals overseas, $60,000, $30,000, $50,000. So I've heard even ridiculous amounts of $20,000 a night. Stuff that is just completely inconceivable for a person who's been blessed with the beautiful health system that we have here in Australia. So mashallah, this is a great opportunity, brothers and sisters, and I have learned a lot this occasion and this presentation. Jazakumullahu khairan.
Okay, Dr. Ashraf, last words from your side.
I think, that Dr. Mohiddin and mashallah, the Imam Said, it's so welcoming to hear, a young Muslim Imam like that with such good words, because it is so important to the community. But I just wanted to throw something out there just at the end, the idea of young females and the way that they've got some vaccine hesitancy. And I would almost say that there is a very, very high risk of them being influenced by the young. They're more likely to be influenced by the Instagram, the TikTok, and these influencers and these pseudoscientists that are these influencers, and whether it's, whatever they call themselves, but they're far from doctors. And the reason why I say this is that it's very important to understand the distinction. Because unfortunately, nowadays, right now, today, everything that is organic, everything that is pure natural over halal and haram, that's, you know, the first thing, the priority is organic, and you have to be so kind to the animal, and the animals, you know, the extent of giving animals rights over even human beings, subhanAllah, is, you know, the halal and haram are almost mixed up. That's secondary. It's the organic. And the idea of vaccinations is essentially a natural form of immunity. It is so natural, and that's a problem, because if you are old, if you're getting older, it means your immunity may not be as strong. So no matter how many times you get the vaccine, you may not get a response. So the idea of the vaccine being purely natural is an important message, because often people that are anti-vaxxers are saying, don't put something into your body because it's so foreign. In fact, this is the least foreign. This is the most natural, because it's reliant on your own immune system. And I think that message, especially to young people, especially to young females, I think is a message that's been lost. And they are influenced by these things. And subhanAllah, I think we need more imams here. I think we need more imams like Sayyid Warsam. We need to hear from the imams. They need to be more courageous. We need to have brave imams, and we need them to be seen on video getting injected. We need it, because the people that pray behind you need to be confident that the imams have been vaccinated, because that's otherwise I'm not going to be able to keep on doing the salah in the masajid. They're going to keep on getting closed. So it's frustrating. It really is frustrating. So I'm really looking forward to the imams making a stance.
We too are looking forward to work with you, Dr. Ashraf, to get injected and vaccinated for all of us. And there are, I'm happy to say there are a few imams who are coming forward, and as soon as we are ready, we will let you know, and then we will have a public event on that. And Alhamdulillah, for 1 hour, we have learned so much about the vaccination, and we hope this particular session has enlightened the Muslim community to come forward in droves to go and vaccinate it and protect our community. This is not only just an appeal from the government that we should do, but also it is a religious duty to not to harm other people by carrying viruses that we do not know, and then we are going around and spreading. This is what happened in the last case, where the person who was contracted the virus, and he was quarantined, and he was in good faith, thinking that he is free from the virus, and then he was going around and enjoying, see what happened. And the situation is this, because of that good faith and also this overconfidence. So it is time for all of us to just set aside all these conspiracy theories and think realistically and go and vaccinate it. May Allah bless you all, and thank you very much for joining this webinar. And we will be meeting you again in another webinar like this with some other experts as well. And may Allah bless you all. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Alaikum assalam wa rahmatullahi wa barakatuh.
Jazakallah, Sheikh Nawaz.
Oh, Jazakallah khair, inshallah. It was very nice, beautiful, alhamdulillah. So it is live on YouTube, and I'm told also we will be putting it in the Facebook, inshallah. So it will go a long way. Jazakallah khair.
Great,
Yeah.
great.
Yes, inshallah.
So it's so important.
Yes, it is. Yeah. Alhamdulillah. And will Dr.